Depression, also known as major depressive disorder (MDD), is a serious medical condition that negatively affects how you feel, the way you think, and how you act. It's more than just about the blues or a reaction to life's struggles and setbacks. Depression can lead to a variety of emotional and physical problems and can decrease a person's ability to function at work and at home. Symptoms of depression. Symptoms of depression can vary from mild to severe and can include emotional symptoms, persistent sad, anxious, or empty mood, feelings of hopelessness or pessimism, irritability or frustration, even over small matters, feelings of guilt, worthlessness, or helplessness, loss of interest or pleasure in most or all normal activities, such as sex, hobbies, or sports, physical symptoms, decreased energy or fatigue, slowed speaking or movements, changes in appetite, weight loss or gain unrelated to dieting, trouble sleeping or sleeping too much, physical aches or pains, headaches, cramps, or digestive problems without a clear physical cause and that do not ease even with treatment. Cognitive symptoms, trouble concentrating, remembering things, or making decisions. Feelings of being worthless or excessive guilt. Recurrent thoughts of death or suicide or an attempt at suicide. Causes and risk factors. The exact cause of depression is not known. However, several factors can increase the risk of developing depression, including biological differences. People with depression appear to have physical changes in their brains. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Brain chemistry. Neurotransmitters are naturally occurring brain chemicals that likely play a role in depression. Recent research indicates that changes in the function and effect of these neurotransmitters and how they interact with neurocircuits involved in maintaining mood stability may play a significant role in depression and its treatment. Hormones. Changes in the body's balance of hormones may be involved in causing or triggering depression. Hormone changes can result from pregnancy and during the weeks or months after delivery, postpartum, and from thyroid problems, menopause, or a number of other conditions. Genetics. Depression is more common in people whose blood relatives also have this condition. Researchers are trying to find genes that may be involved in causing depression. Types of depression. Major depressive disorder (MDD), characterized by a combination of symptoms that interfere with a person's ability to work, sleep, study, eat, and enjoy life. Major depression can occur once in a person's lifetime, but more often, a person has several episodes. Persistent depressive disorder dysthymia, depressed mood that lasts for at least 2 years. A person diagnosed with this type of depression may have episodes of major depression along with periods of less severe symptoms. Bipolar disorder, characterized by mood episodes that range from extremes of high energy with an up mood to low depressive periods. The low moods are very similar to those of major depression. Seasonal affective disorder SAD, characterized by the onset of depression during the winter months when there is less natural sunlight. This depression generally lifts during spring and summer. Psychotic depression occurs when a person has severe depression plus some form of psychosis, such as delusions or hallucinations. Postpartum depression, major depression that occurs after childbirth. It can make new mothers feel disconnected from their baby and be unable to care for their baby or themselves. Premenstrual dysphoric disorder (PMDD), a severe form of premenstrual syndrome (PMS) with symptoms that can include severe irritability, depression, and tension before menstruation. Diagnosis. Depression is diagnosed based on a patient's reported experiences and a mental status examination. Health professionals may also ask about family history and use questionnaire and rating scales. Physical exams and blood tests might be done to rule out other medical conditions that could be causing symptoms similar to depression, such as thyroid issues or vitamin deficiencies. Treatment. Depression is one of the most treatable mental disorders. Between 80% and 90% of people with depression eventually respond well to treatment. Almost all patients gain some relief from their symptoms. Medications. Antidepressants. These are drugs that can help improve the way the brain uses certain chemicals that control mood or stress. They might take 2 to 4 weeks to work and can have side effects. Psychotherapy. Cognitive behavioral therapy (CBT), a form of therapy that helps people change negative thinking and behavior patterns. Interpersonal therapy (IPT) focuses on improving personal relationships and social functioning. Psychodynamic therapy explores past patterns to gain insight into current behavior and emotions. Electroconvulsive therapy (ECT), a medical treatment most commonly used for patients with severe major depression or bipolar disorder that has not responded to other treatments. It involves a brief electrical stimulation of the brain while the patient is under anesthesia. Lifestyle changes and home remedies. Exercise. Regular physical activity can help improve mood. Diet. A healthy diet can help improve mood and energy levels. Sleep. Good sleep hygiene is important for mental health. Avoiding alcohol and drugs. These can worsen depression symptoms and make it harder to treat. Conclusion. Exercise. Regular physical activity can help improve mood. Diet. A healthy diet can help improve mood and energy levels. Sleep. Good sleep hygiene is important for mental health. Avoiding alcohol and drugs. These can worsen depression symptoms and make it harder to treat. Conclusion.